Hello, 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 hello. We've been grooving. We've been grooving. We've been grooving. We've been grooving. Go Deuce. Go Demi. Go Deuce. Go Demi. Go Deuce. Go Demi. Yeah, it's Transformation Thursday here at Northeast Delta Human Services Authority. I'm actually doing some telework because I have children that have been dealing with the flu and ear infections and everything else, as we all know, as these seasons. And right on cue, they already know what to do. They're not trained. They're not trained. But we're excited. We're excited for this Transformation Thursday. My name is Duran Talley, Public Information Director here at Northeast Delta Human Services Authority. This is Demi. This is Deuce. And we are excited about today's show. We have a young lady that you have probably seen shaking hands, moving and shaking, doing different things at some of our community events and outreach. But she has a wealth of information for us that we're doing inside of our agency for our staff, as well as for our clients in the community at large as well. But again, we're excited about Transformation Thursday here at Northeast Delta Human Services Authority, where our mission is to serve as a catalyst for individuals with mental health, addiction disorder, developmental disabilities, and so forth and so on, to help all of us realize our full human potential. And we do that by offering quality, excellent care with greater accessibility. Uh, our vision is truly to build a unified region where individuals are thriving and reaching their full human potential. Without further ado, I'm going to go ahead and bring in our guest of the day. She is the special assistant to the executive director, Miss Richardra Robinson.
Hello, hello, hello. I'm so glad to be here and thank you so much for that warm introduction. Hello, Duran, Demi, and Deuce. How are y'all today?
Doing great, doing great. Say hello. Don't do that.
You're not doing good. That's okay. We don't have good days.
They've been a little sick all week. We've been at home dealing with illnesses, but they're excited to learn and hear, just like the rest of us, about some of the things you have going. First, Rashardja, just tell us, when we hear that title, we see that title, special assistant to the executive director. We know the executive director is Dr. Montez A. Sizer, who is a visionary, who is a leader for more than 10 years. This agency has been formed and executing and improving population health in Northeast Louisiana. But you're that special assistant to that position. Talk about your role a little bit and some of the things you've been up to.
Oh, yes. So, I mean, the key word you said about Dr. Sizer is that he is a visionary. So, my role as his assistant is to carry out the vision and execute those grand ideas that we all know that he has. So, with that being said, my role, I do an array of things. I work right now. We're working on two top initiatives. That is the health initiative, with health literacy initiative. I'm working on that. I started back in October, so I hit the ground running and ensuring that we increase the literacy within the agency. So that is one of the main focus that we want to implement. And I've been working with implementing and launching, which has already done the financial literacy aspect, money, health. So those are the things that we're working on, assisting Dr. Sizer with anything that he does need, anything that what idea he has. I just take it and run, and I make it and implement it and let it grow. So that's
Yeah.
what I've been working on.
Yeah, one of the things I've been seeing you do is building relationships with non-traditional partners for a government agency, such as a credit union. Talk about some of those ideas and some of those relationships, some of those unique, non-traditional, if you will, to a government institution.
Yeah, exactly. So when you say that is non-unique, it really is, because we are a government institution, and most people wouldn't think that, oh, okay, well, what in the world would that have to do with finances or health literacy? Well, we want the best for those who we serve. And in order for us to give and equip those who we serve the best tools, we have to partner with those non-traditional partners, such as banks. Our background is in probably mental health, developmental disabilities. That's the background that we have. But most of us that work here, we don't know much about finance. That's just not our background. So we have to partner with those institutions, such as credit unions or bank, to help us facilitate any workshops that we want to provide for those who serve in terms of finances and budgeting.
Yeah, yeah, and it's important. And I know Dr. Sizer always says we work with the willing. He always talks about opportunities for all, partiality shown in none. And he uses these vehicles of again, non-traditional partnerships in order that we can all work together, break down some of those silos, break down some of the stigma that may exist. Uh, from your perspective and experience in this role, what has been the response when you go into a credit institution or a bank or some of the other non-traditional partners? What is their initial response when you're called and say, "Hi, I'm Richardra Robinson, Northeast Delta Human Services Authority, and we want to partner with you"? What's that response like? What has that been?
Well, sometimes they may be caught a little bit off guard because they're wondering, like, well, what do you want with us? How can we help this agency? So oftentimes, a lot of them already know about us, so they just want to know their initial response. Well, how can I fit in? And once I explain to them what we're trying to do, what we're trying to accomplish, then they're all on board because at the end of the day, like you say, you want to work with the willing. So we all are here to serve our communities and make sure that we carry out the mission of what we're here to do. And if we have those who partner with us who are willing to do the same, then we just make magic. So like I said, it may be caught off guard initially, but at the end, when we're all said and done, we're working together for the good.
Yeah, when you think about Northeast Delta's tenants, the three tenants that guide our actions, usually that should be uniform across industry, across business. When you talk about greater access to services, excellent customer care, quality, competent care, regardless of industry, regardless of business type or product or service that you offer, you're always trying to figure out ways to increase that access to it. You're always trying to figure out a way to deliver it with excellent service, customer service. And then obviously you want your staff to be trained. Let's talk now just more about those initiatives. As I alluded to earlier, one speaks right now, initially in the phases that we're rolling it out, speaks more to our own staff, and that's the health literacy. Tell us about health literacy and why that's important.
So health literacy, is extremely important. I will say before I got in this role, I didn't know much about health literacy. You think about a health and okay, how literate are you when it comes to your health? And to be honest with you, it doesn't matter what your background is. It doesn't matter how many degrees you have. If you are diagnosed with something or you are prescribed anything and you read those pamphlets, you read those labels, a lot of times we're just lost. We don't understand, okay, well, what does this mean? Can I take this medicine, this medication at this time? What does it mean when they say that I have hypertension? Hypertension, those are things that a lot of us get lost in. And we understand here at Northeast Delta that we need to all be on the same page when it comes to ensuring that those who we serve have a high IQ when it comes to health literacy. So that being said, we are beginning to train our staff on how to increase health literacy among our patients. And so with that being said, we're going to all be on the same page. You spoke about customer service. Well, that's the top thing that you need to have. Once you gain the trust and understand and have empathy and soft skills that you can portray and have to interact with your patients, then they'll be able to ask questions that they need pertaining to their health. And then once you're also, we want to make sure that those our providers and everybody's on the same page, that we all speak the same language. So that is the purpose of our training that we will begin next week.
Yeah, certainly. And then a lot of that can even self reflect, right? I always tell people an empty cup can't pour. And a lot of what our staff do is pouring out into others, servicing their patients, their clients. But a lot of times we're dealing with what we're dealing with from home, from life, or what have you. And then we're expected to go and help someone else figure out their health issues or challenges when our cups are empty. And so this too, I believe, will have that effect and impact as well as we begin and our staff begin to understand more and more, regardless of who's a nurse, who's a doctor, who's a clinician, or who's a peer support, or all the various roles, admin support, myself in communications, you in your role, that we all have a better understanding of what good health looks like.
Mm-hmm. Exactly. So, we are equipping our staff with the knowledge. So, like I said, so we can all be on the same page and speak the same language. And it's simple things, things that you may not think about when a patient comes in and they don't understand the things that they eat affect their health. And so, we just with the overall general health, that when you tell somebody that they may have hypertension, they may not have any idea what that is. So if we say high blood pressure or your sodium, they may not know that relates to salt. So those are the small little things that we may know what that means, but because the patient may not. So that's why we are training our staff to ensure that we can give out information in plain language. When we give out pamphlets, make sure it's just not ambiguous with words that only people in the health field will know.
Yeah, yeah, no, that's important, and that segues and transitions into the second initiative that you all have been rolling out, and it speaks to a time that is really important right now because many of the population that we serve, they get that tax return, they don't always know how to manage it. Many of us live check to check, and because of these things, it adds to a bad health outcome or a poor health outcome, and that's finance, right? Financial literacy. Tell us about the financial literacy work that you're doing and why that's important.
So it is important. Number one, we know that if you're not doing well financially, that can lead to stress. That can lead to any type of illness with your mental, your physical health. It's just one of those social determinants that can just be have a negative impact when you do not take control of your finances. You don't have to be rich in order to be financial literate. You can make minimum wage and just understand that every dollar has to be accounted for. So if you learn how to budget what you take in, then that will help you with your overall health, mental health, physical health. So what we're doing is we have those professionals from banks to come in and speak to our patients regarding, and when we get down and we get to their level in terms of how it relates to them. So if we know, okay, well, some of them are fighting addiction and they are transitioning out of whatever that they're in, well, we need to let them know, well, you don't spend every dime on your cigarettes, or you don't spend every dime that you have on alcohol. So we want to make sure that you budget the money that you have. Some habits you can, if you're already kicked it, then keep that and focus on, you want to have that dollar to eat, to live, to purchase a home one day, to purchase a car. So that's the purpose of financial literacy, because after you spend all the money on recreational activities, then you can't really live, and now you're back to square one. So we want to make sure that you get out of that one first square and go and advance in life.
Yeah, and you all just recently had a session, your first session, at our South Grand location here in Monroe. What were some of the key takeaways that you heard or you felt that the population there really marinated on?
Yeah, the key takeaway was Miss Brenda Johnson did an excellent job from First Horizon in basically ensuring that they understood, when you get that check, pay yourself first, put a put a few dollars back, and then when you are out, is it a need or is it a want? And if it's a want, do you want it? Do you have to have it at this time? So those are the things, those are the takeaways that she really enforced them to understand, that just you don't have to buy impulsively. Sometimes we do have severe spending habits, but always self-reflect and ask yourself, do I really need this? And so that means you can keep more money in your pocket. So if a bill comes up unexpectedly, see, you've already paid yourself. So you have that money saved up in savings, or you already just have the money there. So those are the takeaways on our first class that we had. It was really just managing the money and how to budget for your household.
Yeah, understanding the difference between a need and a want. That's a rewiring, if you will, of a lot of our DNA. Because a lot of us over time we've begun to believe that a lot of our wants are necessary. And so
Hmm.
how do you unthink that? How do you untrain that thinking, right? And so yes, you had the first session a couple weeks ago last week, but that's not a one and done type of deal. That's a continued conversation. That's a continued display of specific example of how to overturn that thinking and renew that mind obviously to as Transformation Thursday, to have that full transformation of your finances, because as you mentioned, financial health is going to mess with my mind. Now my mental health is impacted. I'll become so stressed. Now I have medical health, physical health challenges because my money not right. And that's the cycle in which we are at Northeast Delta are beginning to address the root cause. And I've heard Dr. Sizer say many, many times, if we can get rid of everybody's condition, get rid of all the negative social determinants that are driving people to our clinics, that's success. Yeah, that'll mean that we won't have jobs, but what it'll mean is we've now created another opportunity to reinvent ourselves to serve people in another way. So it's not about, oh, if I solve all this problem, we have no job. No, we are innovators. As people who genuinely care for our community, there's always going to be a need. And so while we look at the negative social determinants of health, create programs and initiatives to onset those, to keep people from having to call us at 800-256-2522. Go ahead and plug that number. Right? We want to prevent that. We have an entire department set up for prevention,
yes,
wellness, to mitigate, even starting in our early child programs, going into the pre-K early education programs, where we're starting to look at going through our middle school signs of suicide, so that when these people get to be 18, they don't need us. And that's what we ultimately want to solve. And we'll reinvent ourselves. We'll find other ways to solve the needs of our community and of Northeast Louisiana. So, Richardra, I thank you for what you're doing and how you're going about doing it. Tell us what's coming up next, because I know you've done one. Tell us what to start looking out for in terms of future initiatives and programs that you all have.
Yeah, well, so of course, with the financial literacy initiative, Money Health, that's just not a one and done thing. We had our first at our inaugural workshop for our patients, and that's not going to be the only one. So our goal is to have one workshop at least once a month. So coming up in April, we will more than likely have another financial literacy workshop. I'm not sure what the topic will be, and I don't have a specific day in April, but we will have that, because this is going to be ongoing. You have to continue to pour into your patients, those who we serve, so that we could have a healthy community. So we're not just going to have that one workshop that we had. We're going to continue to do this. And even when they did come, they didn't leave empty-handed. They had all kinds of tools and resources that First Horizon provided them in order to understand how to budget. So they left with something in their hands, so they can always refer back to what we taught them and the notes that they took, and they were very engaged. So yes, we're going to look out for that. Even with our health literacy initiative, yes, we are training our staff on next week, but that's not where the buck stops. We're going to now work our way to making sure that the public and those who we serve understand their health, what their diagnoses are. We're even bringing in a representative from our pharmacy to talk about medication and how that relates to health literacy. So that's, again, we're going to make sure that our population understands and increase their health IQ. And then we're not just focusing on Monroe and the Ouachita Parish. We're going to have our mobile unit. We plan to do that very soon. That's another initiative that we plan to launch, our mobile unit in another parish. So stay tuned for more of those details later. But we will make sure that we touch every single parish that we serve within Northeast Louisiana. So health initiative, that's going to be ongoing. The financial literacy initiative, that's going to be ongoing. But we're also going to make sure that everybody is aware of what we are doing in the community. And you will be seeing us very soon.
Yes, indeed. That's awesome. Glad to hear it. I'm glad you touched on going around throughout Region 8, Northeast Louisiana, the 12 parishes that we serve. We had the initial in Monroe, but you all in the outskirt parishes of Ouachita Parish, stay tuned. Richardra's on the way. She's on the way. Richardra, anything you'd like to add?
No, that's it. I'm just glad to be here and serving those in our community. We will, like I said, just to stay tuned. We're happy to launch all of our initiatives to help. That's the main thing. We want to make sure that we help those that are in need and to ensure that they have the best life, quality of life that they can have. So that's all that I really have today. Any more questions for me?
Yeah, no, I see we got some comments in the chat. Thank you all for tuning in with us for this March 7th, Transformation Thursday. Stay tuned. We'll actually be back next week. We got some cool stuff going on at the HSA. So next week, we'll be back for another edition of Transformation Thursday featuring our prevention and wellness team and our Art is Therapy, Art as Medicine initiative. So stay tuned, stay tuned. And in the meantime, some of you have already found us on Facebook. Go ahead and look us up on Twitter, look us up on Instagram, look us up on LinkedIn and YouTube. Remember, wherever you go, you can always follow the Phoenix. Thank you all. Be blessed and enjoy the rest of this Transformation Thursday.
Bye-bye.